So this is random factlet number 4 from Veterinary ECC Small Talk with me, Shailen Jasani. Actually, I say today factlet, but today is more of a recommendation because I want to talk to you briefly about using antibiotics in patients with pulmonary contusions, whether we should or should not be doing that routinely. So just a quick reminder, pulmonary contusions are basically interstitial and alveolar bleeding and edema in the lung. So in other words, essentially bruising of the lung. And as you know, this is typically due to blunt trauma, most commonly I guess due to motor vehicle accidents, but also high-rise falls and other kinds of blunt traumatic injury. This is a lovely picture that I borrowed from a website which has been referenced in the image, just showing you exactly what we mean when we talk about pulmonary contusions. So the take-home message from today is that routine empirical antibiosis is not indicated for isolated pulmonary contusions in dogs or cats. If we ask the question, what is this recommendation based on? Well, it's based on one single retrospective veterinary study that I could find. Now, I'm not going to go into the sort of critique from an evidence-based point of view about retrospective studies, but obviously we need to bear that in mind. Nevertheless, it was a fairly decent number of cases, so 143 dogs, and you've got the reference there on the screen. The take-home point from this paper was that the incidence of bacterial pneumonia that they identified was only 1%, which clearly is not a justification for empirical routine use of antibiotics in these cases. The recommendation is also based on my own personal clinical experience from well over a decade now of managing patients with pulmonary contusions and not using antibiotics routinely, and likewise from the recommendations of my colleagues in terms of their clinical experience as well. The recommendation is also based on the current human medicine recommendations, and again the caveats of extrapolating from human medicine to canine and feline practice need to be borne in mind, but at the moment the recommendation in human medicine is very much that antibiotics should not be used routinely and empirically in patients with pulmonary contusions. Now there's a couple of quick things that we need to keep in mind. The first is that I'm speaking here about patients that do not have any other indications for antibiotic use, and most classically of course in traumatic patients you would be talking about wounds that meet the criteria for antibiosis, and again that's another conversation for another time. The other thing to bear in mind is that we are not talking about patients that need to have mechanical ventilation, because that throws up again a whole bunch of other discussion points that we would need to be having. Take-home message from today is very much that the routine empirical use of antibiotics in dogs and cats with pulmonary contusions is not to be recommended. Do keep up with Veterinary ECC Small Talk. We have a blog, a Facebook group, and there'll soon be more up-to-date learning material available online, and join our mailing list for infrequent and useful updates. Thanks for your time, and I'll catch you again in a week or so.